Hello, I'm Dr. Ellen Thomas. I believe that the use of Niagara's cycloidal vibration has many benefits to offer sufferers of arthritis. Let's briefly take a look at arthritis and how it affects the body. Chronic conditions of bones and joints are the leading cause of disability and chronic pain worldwide, particularly among the older population. The incidence of these conditions is expected to rise because of increased life expectancy due to medical research advances and lifestyle. Arthritis means inflammation of the joints and is used generically to refer to more than 100 conditions that cause joint pain. Joints are formed when two or more bones are brought together and held in place by muscle and tendons. The joints that have greater range of movement and mobility are synovial joints. These bones that form synovial joints are covered with cartilage. Tough fibrous tissue encloses the area between the bone ends and is called the joint capsule, which is lined with an inner membrane called the synovial membrane. This membrane secretes synovial fluid, a thick, slippery fluid that fills the small space around and between the bones and allows easy movement. In healthy joints, the cartilage is a tough but smooth tissue that reduces friction between the moving parts. Whereas in the most common form of arthritis, osteoarthritis, this cartilage breaks down, which means that bones rub together, causing pain and loss of movement. There are several different kinds of arthritis, two of the most common being osteoarthritis and rheumatoid arthritis. Osteoarthritis is a condition of wear and tear on the joints and is associated with ageing, injury and overuse. It is characterised with progressive joint pain and mobility impairment associated with the loss of cartilage and involvement of the underlying bone. The stiffness of osteoarthritis tends to get worse with use throughout the day. Symptoms include joint stiffness, enlarged joints and pain. The joints affected tend to be the larger joints such as hips and knees. The international burden of osteoarthritis is substantial as it has become the fourth most common disease worldwide. Treatment is aimed primarily at symptom relief as there is no proven cure. The major goals of treatment are pain control, using options with minimal adverse effects, and maintenance or improvement of joint mobility and function to optimise quality of life. In severe cases, joint replacement surgery may be necessary. Rheumatoid arthritis is a chronic autoimmune inflammatory disease where the body's own immune system mistakenly attacks healthy tissue, causing inflammation that damages joints and other parts of the body. The inflammation can affect not only the joint itself, but also tissues around the joint, such as tendons, ligaments and muscles. In some patients with rheumatoid arthritis, chronic inflammation leads to the destruction of the cartilage, bone and ligaments, causing deformity of the joints. The muscles around the joint can also waste away, causing further weakness. Damage to the joints can occur early in the disease and be progressive. Its cause is unknown, however the tendency to develop rheumatoid arthritis is genetically linked, and environmental factors such as smoking also increases the risk of developing rheumatoid arthritis. Symptoms come and go with acute flare-ups and occasional periods of remission. When the disease is active, the joints involved, which are often the smaller joints such as the hands and ankles, become very painful, red, tender and swollen. There is often prolonged morning stiffness and reduced range of movement. Inflammation can affect organs and areas of the body other than the joints, such as the glands of the eyes and mouth and tissues of the lung. Other tissues which can be affected are the lining around the heart, as well as affecting the body generally, causing other symptoms such as fever, lethargy, weight loss and anemia. A recent study demonstrated that rheumatoid arthritis has a significant impact on bodily pain, physical function, social and emotional function and mental health. There is currently no cure for osteoarthritis or rheumatoid arthritis and no known method of prevention. However, the early stage of these diseases presents an important opportunity to alter the course of the disease progression. Treatment of rheumatoid arthritis is aimed at early intervention with increasing gentle physical activity. This will help to improve the blood flow carrying essential nutrients, including oxygen, and increases the efficiency of removing inflammatory waste products. Certain disease-modifying medications, all of which can have unwanted side effects, may be required, which reduce the immune system response and slow the progression of the immune system destruction. So what can Niagara's cycloidal vibration do for sufferers of arthritis? Well, the fact is, Niagara products have much to offer in the management of these conditions. Niagara therapy delivers cycloidal vibration, which is proven to improve lymphatic circulation from the joint. This improves tissue health, assists in delivery of essential nutrients, and improves removal of damaging inflammatory waste products. This helps the body to control the progression of the inflammatory process. Research has shown that in osteoarthritis specifically, after the use of Niagara massage equipment on an affected knee joint, both pain and range of motion was improved. In general, Niagara's cycloidal vibration aids joints by helping to modify muscle contractions, assisting in controlling painful muscle spasms, and improving muscle tone, stabilising and improving range of motion of joints. Cycloidal vibration also helps to improve feelings of general well-being, encouraging the recipient to become more physically active and to make better food and lifestyle choices, which health professionals know make a difference to the progression of these diseases. If these diseases have progressed to a severe state, which requires joint replacement surgery, then Niagara's massage equipment offers options which may shorten the recovery time by helping to maintain muscle tone and reducing post-operative swelling and pain. For sufferers of these diseases, it is important that they maintain a healthy weight, adopt healthy eating, exercise regularly, and of course reduce tobacco and alcohol use. It is also important that they have access to in-home services that support independence and participation in life activities, and receive assistance in recovery from joint replacement surgery if it is required. And so, in my opinion, Niagara's in-home therapy offers valuable benefits to sufferers of arthritis.